All right, I'm starting the recording here. Second.
All right. Good afternoon, everyone. Thank you for joining us. My name is Haley Troy, and I'm a coordinator at the Center for mHealth and Social Media at the University of Connecticut. And I'm honored today to introduce our speaker, Dr. Rebecca Puhl. Dr. Puhl is a professor of human development and family sciences at UConn. She is also the deputy director of the Red Center for Food Policy and Health, where she leads research and policy efforts aimed at reducing weight-based stigma and discrimination. She has authored more than 170 research articles on topics including weight-based bullying in youth, the impact of weight stigma on health, weight stigma in healthcare and the media, and policy strategies to reduce weight-based bullying and discrimination. As a national research expert on weight stigma, Dr. Puhl has testified in legislative hearings on weight discrimination and routinely provides expertise on strategies to reduce weight stigma to national and international health organizations. Today, Dr. Puhl will summarize her research examining weight stigma in public health communication and the media, highlighting the impact of both visual images and language used to depict people with higher weight. She will also discuss recent initiatives and strategies for reducing weight stigma in health communication. Thank you again for tuning in. We ask that you please save all questions for the Q&A at the end, and I will now turn things over to Dr. Puhl.
Great. Well, hi, everyone. It's a pleasure to be speaking to you today about our research on weight stigma and its implications for how we communicate about body weight. So in the time that I have today, my plan is to talk about the ways that weight stigma is present both in verbal and in visual communication, and some implications and strategies to reduce weight stigma, whether it's communicating one-on-one in provider-patient contexts or more broadly in public health communication. So let me first begin by saying that when I'm talking about weight stigma, I'm referring to social devaluation of people because of their higher weight or larger body size. And at the foundation of weight stigma are strongly ingrained stereotypes that people who have a higher weight or larger body are lazy, lacking in willpower and discipline, unmotivated to improve their health, and personally to blame for their weight. And these societal stereotypes are very pervasive in our society, and they really set the stage for different forms of prejudice and unfair treatment. And what we have seen and what's become very clear in the research that we and many others have done over the past couple of decades is that weight stigma is present in almost every life domain, ranging from close interpersonal relationships to educational settings, the workplace, healthcare, and in the broader mass media. And today I won't be discussing all of these different social settings of stigma, but I do think it's important to acknowledge that one of the reasons why people are so vulnerable and why we observe such negative health consequences of weight stigma is that it's essentially impossible to escape this in a person's daily life. There's really no place where a person is protected from these experiences. And there are several decades of scientific evidence documenting the negative impact of weight stigma on people's health. So when a person is stigmatized or shamed because of their weight, this leads to psychological distress like depression and anxiety, disordered eating behaviors like binge eating, reduced physical activity, higher levels of stress, weight gain, and reduced quality of healthcare. And the many negative health impacts of weight stigma really reduce a person's quality of life. And this has led to increasing attention to weight stigma as a public health issue. We know from many other forms of stigma that they are broadly recognized as being harmful to health, but weight stigma really hasn't been on the radar. It's no different than other harmful stigmas, but for many years it's been ignored in this context. But in recent years, we've seen increasing recognition of these harms of weight stigma, both in the popular news media and also from the public health and medical communities. And they're starting to recognize that weight stigma is interfering with prevention and treatment and health outcomes. And this has led to calls from the obesity field, the medical field, from the public health field, to really try to address this problem on a broader scale. And this increasing recognition of the harmful impact of stigma on health has led to more attention to how we communicate about body weight and how this communication is reinforcing societal weight stigma. And this pertains both to how we talk about body weight or obesity or weight-related health and to how we visually communicate about these topics with images and videos. It also pertains to how we talk about weight with individuals in one-on-one interactions like patient-provider conversations, but also more broadly in public health communication targeting large segments of the population. So first today, I'm going to start with talking about verbal communication about weight and how we talk about this issue and the words that we choose to use. So avoiding stigma in our verbal communication requires attention to the language that we're using, to remove unintentional blame or bias, and to recognize that there are different preferences for what words or phrases or terminology should be used in the context of body weight. And it starts to get challenging pretty quickly because there are diverse perspectives about this. So I've highlighted several examples here from different health-related organizations and advocacy groups to give you a sense of these different perspectives. So national obesity-focused, professional and patient-focused organizations like the Obesity Society and the Obesity Action Coalition view obesity as a disease and promote the use of people-first language to talk about obesity, which is namely referring to people with obesity or people who have obesity. The American Medical Association similarly adopts this language for reports about obesity and also encourages use of preferred words that patients have for their weight in discussions involving patients. But in contrast, if we look at advocacy organizations like the Health at Every Size movement and NAFA, which stands for the National Association to Advance Fat Acceptance, we see very different views. So HAES and NAFA do not view obesity as a disease, do not like or use the word obese or obesity. HAES promotes language such as people with larger bodies or people living in larger bodies. NAFA advocates that the word fat needs to be reclaimed, and they promote acceptance of people who identify as fat and they prefer the word fat. And then we have organizations focused on eating disorders, like the National Eating Disorders Association, which has raised concerns not just about terminology, but about even focusing communication on body weight, which they feel raises concerns regarding disordered eating and maladaptive or harmful eating patterns. So, these different perspectives begin to highlight the challenge that we have in talking about weight or obesity or body size. And this doesn't really even include perspectives from the general lay population. So I just want to spend a little bit of time unpacking this a little bit more and talk about some of our work in this area. So the use of people-first language for communicating about obesity has gained a lot of traction in recent years, primarily in the obesity field and the medical community. And the broad premise of people-first language is to communicate by emphasizing that a person should not be identified or labeled by their illness or condition or disease, and that we need to focus on seeing the whole person behind the label. And this has been really an established standard for respectfully addressing people with different diseases and illnesses like mental illness or autism or diabetes or other chronic diseases. And it is broadly accepted as an important aspect of efforts to reduce disease-related stigma. And I would say only in fairly recent years has this been systematically applied to the obesity field, where it is now increasingly common practice to refer to people who have obesity or people with obesity rather than saying obese people. And this practice has become embraced by the medical community and in the obesity field. And it's now, in fact, required language for obesity-focused research journals, as well as conference submissions for national and international obesity-related professional associations. The AMA also adopted a policy about 5 years ago, formally encouraging people-first language for obesity in public-facing reports. So there's been fairly consistent uptake of this practice and communication about obesity. But if we look outside of these fields, that's not necessarily the case. So within various advocacy communities who are promoting health at every size or fat acceptance, and in some body positivity spheres, there's been quite strong opposition to obesity and very intentional decisions to use the word fat. And these communities argue that using person-first language isn't really going to reduce weight stigma, and that fat isn't a bad word, rather it's a descriptor of body size. At the same time, there are also some people who identify as having a higher weight, but they're not comfortable with the word fat, and they prefer to self-describe themselves as plus size or living in a larger body. So there are really multiple perspectives here. And even though what tends to get the most attention in this discussion about language is this debate between using the words fat or obesity, it's actually more complex and more nuanced than just these two words. And it makes for some really legitimate lack of clarity when we try to figure out how are we supposed to talk about body weight without contributing to stigma. But I think much of this can be empirically studied to really try to inform this discussion and provide some evidence-based guidance. And this is an issue that my team has been studying for quite some time. And I actually started studying this more than a decade ago. And for me, it was a news article in the UK's Daily Mail that generated international attention and prompted me to begin doing some research on this topic. And the article that I saw was about comments that the British Public Health Minister had made to doctors in the UK to try to encourage patient weight loss. She said doctors and healthcare workers are too worried about using the term fat, but doing so will motivate people to take personal responsibility for their lifestyles. Calling them obese does not provide sufficient motivation. Just call them fat. Plain speaking, doctors will jolt people into losing weight. So this article caught my attention, and it served as an incentive for my team to do some research on trying to understand what are people's preferences about the kinds of language that their healthcare providers use to talk about their weight. And so we started off with two studies, one with adults and one with parents in the US. And we gave people a list of about 15 different words that can be used to refer to someone with a higher body weight. And we asked our participants to imagine a scenario in which they were about 50 pounds above what they thought they should be for a healthy weight, and to indicate how they would feel if a doctor used each of these different words to refer to their weight. And for each word, we had them indicate how stigmatizing it was, how blaming it was, how motivating it was to get them to potentially want to lose weight. And similarly, we provided parents with a list of words that are commonly used to refer to their child's weight, and we asked them the same questions. And what you see here is that words that were viewed to be most stigmatizing and blaming were words like fat and morbidly obese, whereas words that adults viewed to be least stigmatizing and blaming were more neutral words like weight, unhealthy weight, or even high BMI. Now, as part of the study, we also asked people how they would react if a doctor used stigmatizing language to refer to their weight. What you see is that a high percentage indicated that they would be upset. About 20% of adults, about a third of parents said they would switch doctors if this happened to them. And about 20% of adults, about a quarter of parents, would avoid future medical appointments for themselves or for their child. So we can start to see how language has implications for healthcare utilization. Now, since then, more research has examined this issue, and we see the same pattern of findings in studies with samples of adults with higher weight who are trying to lose weight. And we see a consistent and clear preference for neutral words when it comes to describing body weight. Again, words like weight or unhealthy weight or BMI, but a stronger dislike of words like fat or obese. Now, most of the research to date has focused on adults, but we've done several studies looking at word preferences in adolescents as well, the most recent of which is a study that's coming out in the journal Pediatrics next month. And this is a study in which we looked at perspectives of weight-based terminology in two diverse samples of adolescents and parents. And we wanted to understand what words are parents using to report when they refer to their child's weight, what are adolescent emotional reactions in response to these words, and what are their preferences to refer to their weight, and how do these perspectives vary across demographics. And so we used two independent samples. These were general population samples of parents with children aged 10 to 17 and youth between the ages of 10 to 17. And we established quotas for race and ethnicity and BMI percentiles to make sure that we had sample diversity and weight status. Okay, so each of our samples was provided with the same list of 27 words and phrases describing body weight. And using rating scales, adolescents reported which words or phrases their parents use to describe their weight, how these words make them feel, and which words they want their parents to use. And parents rated how often they use each word to talk about their child's weight. And what we found is that over half of adolescents indicated that they never want their parents to use words like extremely obese or fat or plus size or high BMI. The most preferred terms were healthy weight, weight, and normal weight. But we did see some differences across sociodemographics. So for example, not surprisingly, the term curvy was more preferred by girls as well as sexual minority adolescents. Words like large and big were preferred more by boys and youth with the highest BMI. And the word thick was preferred more by youth with who identified as Black, African American, and Hispanic and Latinx. Now, the terms that you see here on the left side, there we go. The terms that you see here on the left side of the screen induced the most negative emotions in adolescence, with about 1/3 feeling shamed, sad, or embarrassed if their parents use these words to refer to their weight. We really didn't see any differences based on adolescent weight status and only a couple of racial ethnic differences. So for example, the term fat elicited more negative emotions for white compared to Black and African American adolescents. And we also saw that girls generally expressed more negative reactions than boys for about 1/3 of the weight terms. Now, when we looked at parental use of weight terminology, we found that fathers actually reported using more body weight terms and more often than mothers. And we found a higher use of weight terms by Hispanic and Latinx parents compared to white and Black and African American parents. Differences in parental use of words also varied based on their child's weight status. So words like heavy or chubby or fat were actually more often used by parents. This keeps going ahead. Sorry about this. The words like heavy, chubby, and fat were most frequent among parents of adolescents with higher weight compared to parents and youth with lower weight. But about half of adolescents stated that they never want their parents to use these words. And so this suggests that at least in some cases, parents are using words that adolescents don't feel comfortable with. Overall, though, parents said that they tend to use terms like healthy weight and weight more frequently than words like fat and obese and plus size. So at least from this study, we are seeing some consistencies in adolescent reactions to weight terminology, but also differences across demographics. And this highlights the need to recognize diversity in adolescent preferences for weight terminology. And that can be achieved especially in parent-child interactions or provider-patient interactions by asking youth what their preferred terms are when talking about weight-related health. And that can promote more supportive and less stigmatizing communication with their children. More broadly, though, how do our study findings compare to the broader literature? And it turns out that this literature is pretty scattered, and studies have used different samples and different measures. And since there really hasn't been a systematic review of this literature, and I was actually getting asked for guidance about this language pretty regularly, I decided to do a systematic review to try to synthesize existing evidence and perceptions. And this was published in Obesity Reviews in 2020. And essentially, for this review, studies were eligible if they assessed terminology for body weight and people's preferences for weight-related language. It had to be published in a peer-reviewed journal in the last 20 years. No exclusions were made on age, and we used standard databases. And the final sample, after all records were screened and reviewed, included 32 studies that met the criteria. 22 were quantitative and 10 were qualitative. And if we kind of look at the quantitative studies in particular, you can see here that the study samples vary from community samples of adults to adults seeking weight loss or primary care, or parents or adolescents seeking weight loss, and even healthcare providers. And when we combine all of the qualitative and quantitative studies, we see that most studies have at least 50% females and tend to measure participants' weight status, but the racial and ethnic diversity is lacking. So we have primarily white samples. And if we look more closely across these findings, we see that neutral words, again, like weight, unhealthy weight, were most preferred, or neutral phrases. Sorry, I don't know why these keep flipping without me touching them. Neutral phrases like your weight may be damaging your health. The words obese and fat were viewed the worst and least acceptable terms, and these patterns were present across community samples and adults seeking weight loss and parents and adolescents and healthcare providers. Other terms, though, had more inconsistency. So, for example, the term BMI yielded some mixed findings. So some studies found it was one of the most preferred terms, and other studies found it was really not related to be desirable or a motivating word. So there is some inconsistency here. And I also just want to highlight that, again, of the studies that assess differences across sociodemographic characteristics, they typically found that women rated most weight terms more negatively than men. And white adults typically rated certain words more negatively than Black African American adults, like fat and obesity, although both groups generally rated these as undesirable words. Among parents, Hispanic and Latinx parents viewed many of the terms to be actually offensive or confusing, and very few to be acceptable for doctors to use with their child. So I think this really reiterates how important it is to be studying this issue within different cultural contexts. We did see some studies that showed some differences in word preference also across body size, but that also wasn't a particularly consistent pattern. So, we do need to consider this literature in light of some major limitations that I mentioned with sample diversity. And there are some real gaps in knowledge here. One of the things I found interesting is that despite kind of a broad acceptance and endorsement of people first language in the medical community, only one study of these 32 at the time that we published this review actually even assessed or studied patient preferences for people first language. And moreover, almost all of the studies assess language preferences in the context of a healthcare interaction, not within social or family contexts where people's comfort level or use of weight terms might be different. And then we also really don't know what impact this terminology might have on relevant outcomes like patient ratings of healthcare quality or healthcare utilization or other health outcomes. But in the meantime, until that literature emerges, we can at least conclude from existing studies that in adults, in adolescents, word preferences vary across factors like gender and race and ethnicity and sexual orientation, and in some cases, even the extent to which they have internalized weight stigma. And this really highlights the importance of recognizing diversity in language preferences and avoiding making assumptions about what words we should be using. So in the context of interpersonal interactions, like communicating between a healthcare provider and a patient, this can be addressed pretty feasibly by just asking patients what words they would prefer to use and using that preferred terminology. With healthcare providers, we often recommend that if they feel it is necessary to talk about a patient's weight, that they first ask the patient permission to have that discussion and default to neutral terminology, and then ask them for their preferred terms to use. Now, beyond the words that we actually use to talk about weight, there's more that we need to consider when we think about how we communicate about weight-related health behaviors. And how we communicate about eating habits and physical activity and weight-related health can also be unintentionally stigmatizing. So it's important to look carefully at the kinds of words that we use when we talk about eating habits and physical activity, which can reinforce shame or stereotypes. So for example, talking to patients about making excuses in their diet or resisting temptations to eat certain foods can become phrases that are really promote self-defeating kinds of responses. And I'd like to share with you some examples of how physicians sometimes talk about the character or behaviors of patients who have higher weight. So for a number of years, I wrote a blog for Medscape on issues related to weight bias. And the kinds of responses that physicians posted in response to my blogs varied quite a lot. But here are a couple of examples of the kinds of language that physicians sometimes use. So one doctor says, "What's wrong with stigmatizing overweight?" I say a little shame would be okay if it motivated people to change and adopt a healthier lifestyle. Another person says, "After all the comments from gentle reminders to hardcore criticism, the only thing that might work is a mirror and a little self-esteem and common sense. I'm sick of hearing the excuses. Just eat less, get off your duff, and exercise." Another doctor says, "I simply can't buy all the excuses and rationalizations for fat folks. Too much political correctness has resulted in unintended consequences that are destructive to individuals as well as society. Stop making excuses for ourselves and our patients." And then finally, another MD says, "Well, what best efforts? I think too many patients are just too lazy to sustain a diet program." Okay, so if we think about this, The themes that come across from healthcare providers are views that patients aren't losing weight because they lack discipline and willpower, and they're not able to resist temptations, and they're cheating and making excuses and not working hard enough. And this is just one example to show that we need to see changes in the medical environment to ensure that this kind of stigmatizing language is absent. And to go further than that, to intentionally use words and language that is more supportive and empowering. Weight bias can creep in even if we don't intend it to. So we want to be on the lookout for these kinds of issues and think about the moral tone of the language that we use and look for opportunities to improve. So, for example, we want to look carefully at the words that get communicated about eating habits. The word excuse is a word that you saw frequently in the slide of responses from physicians. So instead of talking about excuses, try talking about strategies to minimize triggers. Instead of discipline or self-control, let's talk about ways to practice healthy eating habits. Instead of the word cheat, let's talk about situations that create challenges or difficulties staying on track. Instead of resisting temptation, let's talk about ways to cope with emotions that interfere with eating. And instead of telling patients not to overindulge, let's talk about ways to feel satisfied and not deprived. So these are relevant aspects of language to be thinking about regarding communication in clinical practice settings or with kind of patient-facing materials about weight-related health. Now, terminology about weight and eating behaviors also becomes important for broader communication, particularly in the context of broadly disseminated public health messages. And this is more challenging because you can't tailor your communication to all of the different word preferences that people have. So to try to gain some insights about weight-related language used in this broad public health communication context, we've conducted several studies with general population samples of adults to see how people react to different messages about weight in public health campaigns that target obesity. And for this research, we examined 266 messages from 76 national and broadly disseminated campaigns targeting obesity in the US. And from there, we took a random selection of messages that covered various themes like reducing consumption of sugary drinks and large portion sizes of foods to increasing consumptions of fruits and vegetables and physical activity. And we also included campaigns that were publicly criticized at the time for inducing shame or stigma. And essentially, in each study, we randomly assigned adults to view and respond to a subset of several campaigns from that pool of 30. And we asked them what they perceived to be positive and negative aspects of the campaign message and images, what their emotional reactions were to the content, whether they felt it was stigmatizing, whether they felt the message was motivating to improve their health, and whether they actually intended to improve their health based on the content that they viewed. And two primary findings emerged. The first is that campaigns that used stigmatizing language or visual images generated the lowest motivation for improving lifestyle behaviors and the lowest confidence and intent for making health behavior changes. The second was that campaigns that were non-stigmatizing and instead focused on health behaviors generated higher motivation for health behavior change. And in fact, campaigns that induced the highest motivations and the highest behavioral intentions for improving health made no mention at all of body weight or obesity. Those words were absent. And so these findings suggest that public health communication that may be most likely to generate health behavior changes are messages that are focused on health and health behavior rather than on body weight or obesity. And we saw here that you don't have to mention body weight for people to be motivated to engage in behavior that promotes weight-related health. Now, something else that this research highlighted is that it's not just what we say about weight or obesity that can promote weight stigma, it's also the images that we see. And we broadened our research further to really look at how weight stigma is visualized in the media. And the images that you see here are the kinds of stigmatizing images that permeate the media, whether it's news media or entertainment media or social media. And when it comes to the media, it's very easy to come up with examples of weight stigma across different forms of media. So we see this in how the news media visually depicts people with higher weight, which I'll talk about more in a moment. Social media has received a lot of attention for providing platforms for body shaming and weight stigma. We see many examples of weight stigma in television and film, whether it's reality TV shows or sitcoms or cartoons. In fact, researchers who have studied the top grossing children's movies have found that over 80% have content that promotes weight stigma. And obviously, we know that advertising can promote weight stigma as well, particularly in the diet and beauty industries, where we see from research that diet and weight loss advertising often increases dislike of people with higher weight. So there's a lot here to study, and we chose to start with the news media and how obesity is visually portrayed. And we were noticing that news articles about obesity were often accompanied with images that look pretty stigmatizing and reinforcing negative stereotypes, and sometimes with messages that completely go against the written content of the article. So when we began this work, which was about 10 years ago now, in our first studies, we wanted to get a sense of just how common weight stigma is in visual images that accompany news articles. And so we looked through news reports on obesity-related topics across the most popular news sources at the time, and we coded every image on a number of characteristics. And what we found is that about 3/4 of images and of B-roll videos that accompanied obesity-related news articles contained stigmatizing portrayals of youth and adults, like the ones you see here, which really depict people as headless, often naked stomachs, to really try to emphasize their abdominal weight, or engaging in stereotypical behaviors like being sedentary and eating junk food. And next, we turned our research toward what kind of impact do these images have on public attitudes. So the images that you see here portray the same man and woman, but on the left, they're depicted in stereotypical ways, eating junk food on the couch. And on the right, they are portrayed in ways that challenge stereotypes, so shopping for or preparing fruits and vegetables. When we show people mock news reports with these images, we find that viewing the stereotypical images on the left worsens public attitudes. So people are more likely to view people with higher weight as being lazy, and it increases their dislike of people with higher weight, and they want more social distance from them. But in contrast, when people see the same people portrayed in a non-stigmatizing image, like the one on the right, this improves public attitudes. It reduces weight bias, and people in our studies actually express a clear preference for these non-stigmatizing images. Now, my colleague Natasha Shvay delved into this further with several studies to really try to assess how watching stigmatizing content in popular shows or movies affects people's eating behaviors and their stress levels. So in these studies, these were experimental studies where women of different body sizes came into the lab in individual sessions, and each woman was randomly assigned to one of two experimental conditions. She either watched a 10-minute video depicting clips of neutral scenes or a 10-minute video of clips from popular sitcom television shows and films where female characters were stigmatized or stereotyped or made fun of for their weight. And after watching either video, the woman was then asked to fill out some surveys at a table where we had placed several bowls of pre-weighed candy and snacks. And she was invited to eat as much as she wanted while she completed the surveys. Those bowls of candy were then weighed again after she left the room to see how much was eaten. And what the study findings showed is that women with higher weight who watched the stigmatizing video ate more than 3 times as many calories after that video compared to women of all body sizes who watched the neutral video. We then replicated this study, but this time instead of measuring how much people ate after the videos, Natasha measured their cortisol stress levels both before and after watching either the stigmatizing or the neutral video. And it was found that women of all body sizes who watched the stigmatizing video had much higher cortisol reactivity compared to those who watched the neutral video. And so what this tells us is that women find these stigmatizing clips to be stressful to watch, even if they don't have a higher weight themselves. And this can help us to see that being exposed to weight stigma in the media is harmful both to societal attitudes and also to personal health. And just to hone in on these findings with respect to cortisol levels, I want to mention briefly that participants in these studies abstained from eating or drinking for several hours before they participated. They all participated at the same time of day. We included covariates like how many minutes they were awake, their days since last menstrual cycle, their BMI, their self-reported stress, their depression, etc. And women of all body sizes who watched the stigmatizing video were equally likely to find that video upsetting and were equally likely to report report that they would rather not see people with larger bodies depicted in a stigmatizing manner in the media. And I will mention that several colleagues of mine at UConn, Linda Pescatello and Greg Panza and I, recently replicated this randomized study design in a sample of women with high blood pressure and normal blood pressure, and found that watching the stigmatizing media clips increased cardiovascular reactivity and high blood pressure in both the lab and under ambulatory conditions. And so we continue to see the negative effects of stigmatizing media communication of weight on people's health. So what are we trying to do about this? Addressing stigma in the media is a big problem that requires big solutions. So we started chipping away at different ways to intervene. And following the studies that I mentioned on the impact of stigmatizing images, we decided to create the first media gallery, or sometimes we call it an image bank, containing hundreds of respectful images and B-roll video clips of people who have higher weight. And we made these galleries, these image banks, accessible and free to the public, and especially to the press. And for this, we conducted our own professional photo shoot for this initiative. We also created media guidelines for ways to reduce stigma in media reporting, and these have been disseminated pretty broadly. And after we made our gallery public at the Rudd Center, other national organizations started creating their own free galleries as well. And that's terrific because it just expands the options even further. So organizations like the World Obesity Federation, Obesity Canada, the Obesity Action Coalition, they all have free image banks. And I encourage you to take a look at all of these free galleries and to use these images in your own presentations, your own educational materials as a way to make sure that we're all reducing stigma in health communication. And I will say briefly that we've had considerable success with our images being used in the national press. I've highlighted just a couple of examples here from Time Magazine, National Geographic, and CBS News. And CBS actually used our images as part of an educational segment that they did to educate their viewers on visual weight stigma. And they used our images as examples of what the media should be using to help reduce stigmatizing portrayals. And when photo editors choose to use these photos in their press articles instead of the typical headless stomachs or people engaging in stereotypical behaviors, which we often see on stock photo websites, it can really help to be part of a solution to be selecting these images. And again, it's not just the press that's using these. We've seen them in many public-facing documents in the medical community. We often have researchers and scholars using these in their conference presentations, and that's exactly what the intended purpose is. So I do encourage you to take a look. And I just want to end off this discussion today on another positive note by mentioning a recent initiative that was brought to life this past summer to really try to address weight stigma more broadly in the media and on a national level. So last spring, I was contacted by the Media Empathy Foundation, which is a nonprofit organization that is really dedicated to promoting a culture of empathy related to people who are struggling with disease-related stigmas. And they wanted to put together a spotlight event with major figures in the media to bring attention to weight stigma and how body weight is portrayed in television and film and advertising. And at the end of June, they held a first-of-its-kind event in New York City with a panel discussion really featuring leaders from different media industries. And it was informed by a research report that the foundation had created to summarize the harms of weight stigma in the media. And the event itself was put on for an audience of media content creators from television and film and advertising, with the goal of trying to really create a catalyst for more content creators to prioritize addressing weight stigma and more respectful portrayals of people of all different body sizes in media. Oops. And some of the people on this expert panel I've highlighted here include Mike Pasternak, who is the founder and president of Lionsgate Motion Pictures, Deborah Roberts and David Sloan, who are senior producers of ABC News, Orlando Reese, who's a senior executive at Univision, and Jeff Maschey, who's the creative director for Donna Karan. And I can say, as the only researcher on this panel, it was pretty inspiring to me to be able to talk to these media moguls to really try to raise awareness of weight stigma in the media and how to address this issue. Really, the key objective of this event was to discuss where change is needed in the media and what the steps are for initiating that change. And we're now working together on prioritizing those next steps as part of a media action plan. So from my perspective, this kind of initiative is really essential in order to reduce stigmatizing communication about body weight. There are many different levels that we can focus on in brainstorming solutions and remedies to address weight stigma in communication. But what we know from research is that individual level approaches to reduce weight stigma don't work very well. And the reason is that trying to change a person's biases about weight is really hard to do if the messages that they view and they see in the mass media every day do the opposite and reinforce societal stigma and blame on people for their weight. And that's a key reason why stigma reduction efforts in the media are so important, because of this profound influence that the media has to really shape public attitudes and beliefs and opinions. And it's my perspective that really only by implementing change in the media can we start to see the kinds of broad-based and lasting changes that we need to see to create a society where people of all body sizes are treated with respect and dignity. So, in summary, whether the focus is on verbal or written or visual communication, the evidence that I've shared today gives us reason to pause and to think carefully and more thoughtfully about how we communicate about body weight. Many of us are involved in disseminating health information in different ways to different groups and audiences, and we need to be giving consideration to questions like, is it appropriate to communicate about body weight in this context, or is it unnecessary? How do we focus communication and messages on the importance of weight-related health without unintentionally reinforcing bias or shame? And is your message or the content that you're communicating respectful to people of all body sizes? And as I've talked about today, there really are some tangible ways to do this. We can default to neutral words if you communicate about weight, respect diverse preferences for weight terminology, use people's preferred words when talking with them, choose language that is supportive of health behavior change, and select visual content that is respectful. And regardless of what perspective we're coming from or what information we aim to try to disseminate, I think we need to ensure that we communicate in ways that support and empower people rather than unintentionally evoke shame or blame. And we're most likely to be successful doing this if our communication is promoting healthy behaviors for people of all sizes and is intentionally aiming to really preserve respect and dignity towards people of different body types. So I'm going to stop there. I want to thank you for your attention today, and I'm certainly happy to answer any questions with the time that we have left.
Great. Thank you so much, Dr. Puhl, for that thoughtful discussion about weight stigma and how it's communicated in the media. For those of you who have questions, please feel free to pop them in the chat. You can also feel free to unmute yourself to ask a question. One of the questions, just to get us started off, is what is one or two of the biggest barriers in your mind, Dr. Puhl, for reducing the societal stigma that you were mentioning a few moments ago?
That's a great question. I think a major barrier that is a real challenge is the lack of any kind of policy that exists to address weight discrimination. So currently in the US and frankly pretty much everywhere else in the world, it is legal to discriminate against people because of their body weight. Only in the state of Michigan and a handful of cities across the country have laws been passed to prohibit weight discrimination. And that really sends a message that this form of mistreatment is tolerable. And that's one of the reasons why we continue to see so much unfair treatment occurring in multiple aspects of society, whether it's employment or healthcare or education. And so policy change from my perspective is a big barrier for sure. And then I also think that, as a society, we still rest on this misperception and misassumption that body weight is an issue of personal willpower, personal choice, and personal responsibility. And those views, those beliefs really form the foundation of weight stigma. And we really need to be challenging those to really educate folks that body weight regulation is very complex. It involves many factors that are contributing, of which personal behavior is one piece, but it's only one of a much more complex puzzle.
Great, thank you. I have a follow-up question. So in terms of policy change, what is your experience in terms of communicating some of these really important findings from academics, people who study these sorts of things professionally, like yourself, how to get that communicated effectively to those who have positions of power to change policies, change the way that our society functions? Like, can you talk to that a little bit?
Yeah, it's a really great question. When I started my career, I used to primarily talk about weight stigma as a social injustice, like so from a social justice lens. And I do believe very strongly that this is a social justice issue. But that framing wasn't having the kind of impact I thought it would have when I was communicating to decision makers in the medical community, for example, or in public health. It wasn't until I started talking about weight stigma as a public health issue as well, with significant health consequences, that people started paying more attention. We know that many stigmatized groups are facing health consequences because of their stigmatized identities. We know that stigma is an enemy to public health. Weight stigma is no different, but it hasn't been treated with the same attention or resources or policy remedies. And so explaining that evidence and kind of showing medical professionals the ways in which weight stigma harms psychological and physical health and reduces quality of life, reduces healthcare, that started to get people's attention. And so now I really try to emphasize both of those messages when I'm trying to talk to people about policy change, whether it's societal policy or medical policy, that weight stigma is both a social injustice and a public health issue. And it needs to be addressed on both of those levels if we're going to shift societal attitudes to reduce discrimination.
Wonderful, thank you. I'm seeing a couple questions in the chat. First one, you had mentioned much of the literature to be informed by primarily Caucasian samples. How can we recruit more diverse populations, which we see have higher rates of obesity?
Yeah, this is so important. And it's actually, I think, important to know that this is a broader limitation of the weight stigma literature in general. So it's not just with terminology and language, but more broadly with weight stigma. And that's one of the reasons, in the recent study that I mentioned with adolescents and parents, we actually worked with a panel to set quotas for race and ethnicity so that we could really have very meaningful comparisons to make. And that was really important in identifying differences and preferences across these groups, and is telling us that preferences for words and terminology do vary across issues like race and ethnicity. But not only do we need to be sampling with more diversity, we need to be creating measurement with more diversity. So even the measures that are getting used have been developed with primarily white samples. So that actually is a call to all of us as researchers to make sure that we are really developing and testing culturally sensitive measures with diverse populations.
Great. The next question I'm seeing in here, what is the most effective response to people who claim that you can in fact be healthy at any size? In other words, those who refute the scientific evidence on excess adiposity and its impact on health.
Right. So, where I agree with the health at every size movement is the focus on promotion of health and health behaviors rather than only focusing on the number on the scale, of promoting body acceptance and diversity and trying to reduce weight discrimination. I do also think it's important to note that BMI on its own is not should not be used as the only indicator for health. There's many other indicators of health that should be considered as well. And so, those central messages of Hayes align with my perspective. I think there is a growing perspective in a number of health-related disciplines that we should be promoting health and health behaviors of people of all body sizes. Where I have concerns, though, is when there is dismissal of strong science demonstrating clear consequences of health that can occur from obesity. And that's not to say that every person with a diagnosis of obesity is going to have comorbidities and health consequences, but there is strong and consistent evidence that obesity can and does lead to health consequences for many people. And so it's irresponsible to dismiss that science. My approach is to typically focus on where perspectives align and where there is common ground to work from. And I think focusing on promoting healthy behaviors for people of all body sizes is an area where we can start, is one of those areas where there's common ground.
Thank you. So next comment, thank you, Dr. Puhl, for a great presentation. In regards to social media, this platform continues to grow, and I can imagine it's hard to regulate in terms of encouraging users to utilize non-stigmatizing language. Have you thought about how we can also educate the general public to communicate about weight and healthy living effectively through this type of media, for example, social media literacy intervention?
Yeah, I think we often look at social media as the evil that's contributing to poor body image and eating disorders and stereotypes and stigma. And in many ways it is. So there are many evil aspects of social media. But I do think that we can look at its influence and power and try to use that for positive change as well. Whether it's, educating consumers about language, whether it's promoting accurate information about body weight, about obesity, so that we have some accurate information to challenge the things that we see on social media that promote eating disorders, or the diet related messages that we see from the diet industry. There are a lot of opportunities, I think, to be channeling social media in more positive ways. That doesn't necessarily mean it's going to eradicate all the negative that we see coming from social media, but given that it is such an influential platform, we need to be doing more to harness that. And we've seen, many social movements really take shape and really form because of online engagement on social media and activism on social media. And I think that can be used here as well.
Wonderful. That sort of flows right into our next question. What are some examples of brands that you feel have done a good job of reducing stigma in their advertising? Additionally, what are some brands that are more stigmatizing?
I wish I was tracking this more closely. I feel like sometimes I see ads and I think, oh, that's terrible, or oh, that's really good. And I'm not like recording and monitoring it the way that I probably should be if I was going to study it more. But I will say that I've seen groups like Dove do a nice job of portraying women of diverse body sizes in their brands and selling their products. And I think we're starting to see a little bit more of that. I do think there's a long way to go. We are still in a very thin obsessed society, and that is evident in the vast majority of advertising. But I think groups like Dove can show that, or are showing that, you can be successful with your brand and your company with body size diversity and body acceptance. So that's a nice example that comes to mind.
Great. Just looking at the chat again. Thank you, Dr. Puhl. What would you recommend to health professionals that also have diverse perspectives of the language around weight? That is, non-dieting dietitians versus obesity disease dietitians.
So the first part of that question was, what can we do to help? So can you just repeat the first
part? What would you recommend to health professionals who also have diverse perspectives of the language around weight?
I think the bottom line is that when we're working with patients, whether they want to lose weight or not is their choice. And we have to respect that choice, even if it departs from your own. And I think regardless of what that patient's choice is, what we can do as health professionals is focus on health and health behaviors, regardless of the number on the scale, regardless of whether weight loss occurs. We know that health benefits can occur even if the number on the scale does not shift as much as a physician might want it to, or as a dietitian might want it to. So I think we have to recognize that there are very strong opinions when it comes to whether weight loss is advisable or not, and that a person's decision to engage in that process is their decision. It's a personal decision, and we need to do what we can to be respectful and supportive. And I think focusing on health and emphasizing health behaviors in that process is a good perspective to take.
I'm now seeing the responses from the MDs about how they feel about their patients with obesity was really heartbreaking. I'm wondering about the role of stigma in their responses. Do you know if doctors feel this strongly about other conditions that are perceived as preventable? Would they respond as negatively if they were asked about injuries related to exercise, for example? Would doctors be as frustrated or respond as negatively if they were asked about a patient with conditions that was perceived as preventable, but that wasn't stigmatized?
That's a really good question. And, I don't know that has been specifically studied among physicians. It has been studied in the general population. And in general, what that research shows is that other forms of bias have tended to decrease over time, whereas weight bias hasn't as much. And in some cases, it's going in the opposite direction. And one of the things that I think distinguishes weight stigma from other kinds of things that might frustrate MDs about patients is that there's so much personal blame still attributed to body weight. And I think it's important to step back and remember that medical professionals are not immune to the negative messages that we see in society every day about body weight. And so it's in some ways not fair to expect that that bias would be absent. We want to hope that it would be absent. We want to think about healthcare as a bias-free environment. But the reality is that we all are subject to these societal messages. The other kind of unfortunate reality is that weight stigma really is not on the radar in medical education. So, and obesity often doesn't get very much airtime either. And so, there's a real need to make sure that we are addressing weight stigma as a required component of medical education, whether it's included in diversity curriculum or attached to obesity or nutrition curriculum, to make sure that that training happens, to make sure that students who are training in professional health disciplines are being exposed to this topic and understand how it affects their patients and know what strategies to implement in their training. And I think, what we can all do as health professionals is to think about what assumptions we make about body weight, what attitudes we have, and think about how do I feel when I interact with patients of different body sizes, or what assumptions do I make about people who have larger bodies, and then start to challenge those assumptions. So think about where they come from, in what ways might they be inaccurate, how could they be unintentionally harmful to patients. Think about people who challenge those assumptions. And I also think it means that we have to speak up as health professionals when we see examples of weight stigma in our clinical care environment, even if it's among other colleagues. We want to be modeling respectful communication that we want other people to use, and to really try to educate our colleagues about this issue as well.
Great. I believe we probably have time for one more question, and I see one in the chat. So this question is related to socioeconomic status and regarding geographic location. So it says, how effective do you think that educating providers about the impact of census tract location or abundance of food deserts for lower SES populations or persons of color in partnership with this work? A bodega doesn't have the same quality as Trader Joe's, and one can't walk or exercise in a neighborhood that isn't safe.
Yeah, I think that this is part of important messaging as well. And it starts to get at issues of food insecurity as well, where there's tremendous stigma. And so there are really layers of stigma that people are experiencing. And I think that, weight stigma can be a message that is integrated along with these other messages of stigma and barriers related to access to healthy food, which are real challenges in many places in this country. And I think that's also just an important kind of issue for us to think about more broadly, is that for many people, they are experiencing multiple stigmatized identities. So they're experiencing stigma because of their weight, because of their socioeconomic status, because of their race, ethnicity, or their sexual orientation. And all of these layered stigmatized identities really can compound to worsen health outcomes. For most people, they are dealing with more than one stigmatized identity. And I think that the question that was just raised starts to get at that a little bit, and the importance of recognizing these multiple identities in the people that we work with.
We do have a couple minutes left, so I'm just going to follow up and ask Dr. Puhl, where does the research go from here? What are your lingering questions for future projects?
Well, I always have my foot in some kind of policy research because policy change takes a long time, and I feel like we need to keep pushing there. So we've done a lot of research looking at public support for different kinds of policies to address weight discrimination and weight-based bullying. And we are seeing substantial support in American adults to essentially pass laws that would make it illegal to discriminate against people on weight, about their weight. And I think that's important because policy change doesn't happen unless public support is clearly established. And we've been doing that work for a long time, and we see that it is established. And so I think that the next step is to now convince policymakers to take this on, to champion this issue. There are policymakers who are. So, for example, Massachusetts has been trying to pass a law really for quite a long time now. They're getting closer. And I think as we start to see more states taking this on, that others will follow suit. So policy research is really important, an important piece of that. There hasn't been very much done in the weight stigma arena, and it's an area that we need to keep plugging in on for sure.
Great. I see that we are running out of time, but thank you all for the wonderful questions. And of course, thank you, Dr. Puhl, for your thoughtful discussion on this important topic. If you have any lingering questions, please feel free to reach out to Dr. Puhl via email, which I'm popping in the chat now. But otherwise, thank you again for joining us, and take good care.